Come on in, you guys, and say hi to everybody at Seeking Integrity who is there for treatment, and I will see you tomorrow.
Tomorrow. So the first question, I've been sober as defined by SAA.org since December of 2020. Trickle disclosure to my wife was in November of 2020. I am in a 12-step program. I have a CSAT and I regularly attend meetings at our drop-in groups at SRH. My acting out behaviors are lusting, wanted to be lusted after pornography and image addiction, no sex or anything like that outside of my marriage, and all the lies and deceit that come with it. I've read of the book Out of the Doghouse and Help Her Heal. My wife and I went through the divorce process and had the courage to step back into the relationship with me in October of last year. During our I lived away during most
When they
of
were
the time
apart.
coming back, and out of the house, and we have children together. Right now, she feels like she doesn't respect herself for deciding to come back into the relationship with me. She is withdrawing and no longer affectionate, etc. Can you give me some insight on how best to show up for her with these feelings? I hear this often where partners, you really struggle with, I'm humiliated, or I what's wrong with me? That I'm letting this happen. So what are your thoughts on that?
Well, this is a very personal question because I don't know the situation, the spouse, where they're coming from. But I can honestly say, like, my first thought was, this is the perfect kind of dilemma which belongs in couples therapy. This is absolutely, there's sobriety, there's growth, there's been working through relationship. Now you've got an emotional problem that you don't want to drive you apart again. So this is where I think a really good professional could help you guys figure out, are you doing something to trigger this? Maybe when you do some particular thing or don't do some particular thing, she gets triggered. On the other hand, spouses, as we know, are on a roller coaster and they can go back and forth and back and forth. But what I hate hearing is that she's not happy with herself. And even if she came back in the relationship, it didn't feel that it was working for her or right for her, good or bad, right or wrong, I still would want her to feel like I gave it a good try. I did my best. It was good to check it out. I say to the guys in recovery who are having affairs, you have to stop having an affair before you decide to move in with the affair partner, because how will you ever feel you gave your relationship a full chance if you still had one foot out the door? So it's kind of like that in some ways. Hey, Tammy, what do you think?
Well, it's challenging because it feels like there's things, like I hear what you're doing, for your recovery. I don't hear what her support has been. And so that's the kind of the missing piece. And maybe she has been,
right,
doing the betrayed partner things. But I hear unprocessed grief, grieving the loss of what she'd hoped for, grieving all of that, and the roller coaster that Dr. Rob just mentioned of the emotions and feelings, but the feelings stuck, like that. I mean, if she's stepping into the space, what is it that the two of you want for the relationship, and how can you, with where you are right now, move forward in a different way? Yeah, I like working with a qualified couples therapist for this. Dr. Rob did, and I've mentioned this one before, Dr. Rob did a podcast on which is posted on our sexandrelationshiphealing.com site, but with Dr. Stan Tatkin about We Do, which is Dr. Stan's book. But it talks about, in a healthy relationship, it's the two of us against the world. And if we're focusing on what's good for the relationship, it's good for both of us. And it feels like she's not there yet. Like it feels like she's hurt, but is there some mutual goal for the relationship that you guys can come to, where focusing on that, helps each of you feel like you're doing what's good for the relationship? Because the other thing Dr. Stan talked about is, in a healthy relationship where it's the two of you focus on if it's good for the relationship, that's healthier for either or for each of you individually as well as the relationship. When it's one person, which is what addiction is one person, being self-serving, then a relationship can be unhealthy and worse for the individuals in it as well. That's the most simplified version of the more get the real stuff from the podcast. But so that's what I just kind of wonder about is, can you shift the focus to how do we work on the relationship
Mm.
together?
That's exactly what it relates to exactly what I'm going to say. There's a really simple question I have for you, which is, what have you said to her? Have you said, I really feel like you're drifting away, or I'm worried that we haven't found, or I'm so concerned that you feel you've disrespected yourself, because I feel this has been a good trial period wherever we end up. I mean, how much are you sitting down and expressing your concern and your care in a non-manipulative way? And that's, of course, the important part. Well, the kids are here, that would not be a good way to start. You want to give her, in fact, this is a situation where I think someone really wants to have control. So I would absolutely let her have as much control as she needs to. But I would not be shy about saying, I really love you and I feel like you're drifting away and I don't know what to do about it. And, am I missing something, or do we need a couples therapy? Start with her. What a
And
simple
communication.
idea.
Yeah. And verbalize it. Yes.
And bring her
Okay.
here.
Yes. This is, I've been a sex addict since I was 18. I'm now 64 and was diagnosed 5 months ago. And for the last several years, I have transitioned from acting out weekly to just porn for the last few years. Does this change my diagnosis or treatment regimen? I've shifted what
Yeah.
I'm doing. So it feels like minimizing the harm reduction, but
Well, um, what am I going to say about this? When you're a younger person and you start to have problems with porn from the get-go, or over time, you're 25 and you haven't done much dating, and that is a very different set of circumstances than this. I mean, you said that you've been an active sex addict for many, many years. And what I'm getting from this, Tammy, is this person transitioned from seeing sex workers or having affair, whatever they were doing, to just porn. And I think, we would say that addiction is like whack-a-mole. You knock something down in one place and it pops up in the other. So I don't think it really matters whether it's expressing itself this way or that way. And by the way, at 64, no discredit to your hard work, but it's not that hard to slow down your sexual life to some degree. And most of the men, and Tammy, I have to say this, do you believe that we have people, I want to say this in a loving way, it blows my mind that people come in at 80 years old to come to treatment with us. I mean, I don't know. I'd be sitting on a beach with a pina colada, like, forget the weight loss.
And
But
I feel like this is hopeful, that I want the next 20 years of my life to be very different and have integrity that I've lacked. So I rock on.
and the other piece I think is, if, I don't know how long I'm going to be here, but I want to be at peace with myself and the
Mm-hmm.
people I love. So anyway, but being 64 is a little bit easier to slow down on the sex. So I'm not sure you get, I don't think, Tammy, and I want to give you a lot of kudos here. Because yes, it does seem like you've switched from one thing to another. The diagnosis is being an addict, and it doesn't really matter. My question though is porn interfering in your life? Does it make you feel bad about yourself? Is it having negative consequences? Are you in a relationship where the porn is not acceptable? Is it compulsive? I mean, I don't know your particular situation, but the way you ask it, it's kind of like going from whiskey to wine. You're still drinking.
Well, and I ask often, are they switching to another form of, self-soothing? It can be, we just read an
Hmm.
article today about gaming is now, like in the ICD-11, they're talking about compulsive gaming, because I know lots of
Hmm.
people who have switched. Well, it's just gaming. Well, it isn't
It.
anything that takes us away from being. Dr. Rob said, are you in a relationship where this is problematic? My question is, are you in a relationship? Like, do you have real people
Hmm.
in your life, or is this
Hmm.
your life is just this isolated, and disconnected? So to me, what we do at our treatment program, regardless of the men's age that come to us, is we're working on stopping the problematic behaviors, but address the underlying issues. And my question is, what's going on that you started as a sex addict at 18? There was probably stuff going on for
Right.
you before that that makes you uncomfortable with just being and being connected in a real and meaningful way with real people.
Mhm. You know, Tammy, I'm thinking that you say that, thank you, is that this is the wrong question. You know, the question is, why am I still acting out at 64? Or why? And by the way, just to say it, you know, if I'm questioning something, it probably isn't a good thing. You know, I don't question when I go have a sandwich, but if I say, should I talk to this person or not? It's probably something ain't right about it. So you're questioning something. I think you're asking the wrong question, though, which is, why am I still tied to this leash? Is this the way I want to live my life? I have to look back. It's all one continuous thing. So you can say it's just this now, but it's, you know, how far are you looking back and how your sexual life affected you at 30 and 40 and, you know, all of that. So I think you're asking the wrong question, because the question is, how did I get this way? How do I stop? And how do I look at myself in a way? How can I bring this into some kind of light so I can understand where it came from, why, you know, just understand myself better? Because the question is not, is this or is that that? The question, I think, is, how do I stop? And how can I take a really good look at myself and understand how I got here in the first place?
And and going back to what we just said a little bit ago about the age, what do you want, for now, for the rest of your life? Do you want to be just looking at porn and disconnected, and or do you want to have meaningful connection with real people? So, and maybe that terrifies you, it might, but I'll tell you what, it's so much better than the problematic behaviors that we get in acting out. So, okay, next question. My husband is having a hard time finding a therapist. We get so much from the resources here in Dr. Rob's podcast, but can't seem to find a therapist on the same level. That's because there's only one Dr. Rob. I just had to throw that in. He would like to find a CSAT therapist, but hasn't been able to find one in our area under insurance. I'll talk about that in a moment. His last two therapists don't give him much feedback and ask him to fill out surveys or read books. He attends an SA group, and we see a marriage counselor together. Is that enough? We both feel he should dive into his childhood more, but he's not able to do that so far. So most CSAT, I do recommend, and Dr. Rob put it in the chat, Tammy, TAMI at seekingintegrity.com. And I do need to know where you're at. That said, if insurance is your primary focus, you will have a very difficult time finding them. They're therapists, and then they take more training. Most therapists don't have addiction training. Even fewer have this specific. I say this all the time to people. It's like you if you have cancer, you want the cancer specialist. You want somebody who really knows what they're doing. So to me, and I don't know where you are in the process. We early on in the process, marriage counseling is less effective. And again, if you have a marriage counselor who's doing regular marriage therapy instead of this kind of work, it's very different. And often it not only doesn't help, but sometimes it can be more problematic. So there are trained therapists, and most of them, even if they don't take your insurance, will provide you a super bill after you have sessions, and you can submit it for some reimbursement. At some point, like, is treading the same water over and over again, or do you want to get to someplace different? Dr. Rob, I'm going to say two more things. Dr. Rob does a one-time expert consultation. He does these via Zoom, so he does them with people all over the world. They're not therapy, but he does this, and he's really good at helping figure out, here's the issues, here's where you are right now, and guiding next steps. So it can be very
Life
helpful. And
changing.
it's
I've
discerning
seen,
for, like one couple said, I've been to 4 different therapists over the past 2 years, and nobody was really able to help them in that moment figure out what to do, and Dr. Rob was able to do that. So again, reach out to me if you want that. The other thing is, if somebody's stuck, if he's not getting enough help, That's what our program is. We have an expert treatment program for men with sex addiction, intimacy disorders, or some have co-occurring chemical addiction. And sometimes they've stopped the problematic behavior, but they're just not getting that solid foundation, or they're struggling with relapse. They're just not getting a clue how to live in a very different way. And that is what our expert clinical team is able to help with. So those are some options. We have supplemental things like the work groups and things, as well. So there are some supplemental things, but getting the right help. This is like the cancer treatment. You want the right help. This is hard stuff, and not getting the right help, it's like you're lost in the woods. Get the right help. So, okay.
Well, no, I just want to say one quick thing, and it's not. Look, if you know me at all, I'm very, very honest and truthful sometimes, well, often to a fault. And so I'm going to tell you the real deal out there, which is many clinicians who are unable to develop a very healthy private practice and get cash payments. In other words, the ones who either aren't very skillful at letting people know they're out there, or the ones who aren't particularly good, they want a paycheck. So they go work for insurance-based programs, or they only take insurance. That's just the best that they can do. And I don't in any way mean to insult anyone who takes insurance. I'm simply saying that when you get to the level of a specialist, you have to really have the resources to pay for that. And it's not easy to get one of these. I mean, the CSAT takes how long, Tammy? Over a year?
It's 150 hours of
Right.
additional training, and then you still have to continue. In order to keep that, you have to continue to get continuing education. So yeah, it is a
So
requirement.
I want to say just a little sad thing that may help. I have a dear friend who passed away last fall, and he went to one of those, just pay one fee and you can see every doctor here and you can't choose anybody, but you just go to our clinic. I don't want to name it. But there was a sort of an all-in-one shop, and that's the only place he could go for medical care. And he didn't want to pay for the preferred ones where you could choose your own doctor and all of that. So when I heard his treatment plan for cancer, I thought, oh, I wish you weren't getting treatment there. I wish you were going to a place that had a higher level of clinician, because they walked him through and they did the right thing. And, but I think he could have lived longer. He was eventually going to pass anyway, but when it comes to healthcare, and I hope you understand that mental health is healthcare, I want the very best that I can find. And, as Tammy said, most of them give you, now, granted, you're only going to get $25 back per session, but they do give you a super bill and you can send it in. And so, if you at all have the resources, I really recommend you, at least for a short period of time, try to seek out someone who can put you on the right road. Because yeah, it's like having a specialist. I mean, a specialist, you want a specialist, and most of these folks are general clinicians.
Yes, and I don't know what your reimbursement will be. I have a great therapist. I pay her, and then I get some reimbursement. And you know what? I'd pay the whole amount I submit to reimbursement because I want that. But it's about the help she gives me, and I,
Right.
so it's.
She gives it to all of us, Tammy, trust me. Your
You
therapist
don't
gives
know
all of
my
us help.
therapist. Yeah.
No, but believe me, through you,
Yeah.
we
Oh
all
yeah.
get
Well,
a lot of
thank you. I
support.
hear what you're
We
saying.
do.
Yes. Yeah. No. Yeah. She saved my bacon during COVID. I was not doing well. So yes, she gave me focus. It was good. So, okay. So, next question. Spouse talked with a marriage counselor and said, not an addict. Oh,
First said,
yeah. Yeah. Because he still desires his spouse. Then he admitted it was a binge thing because he could go years with no porn. I addressed his hurt heart somewhere or somewhat, and he said he would take the addiction test on this site. Is he an addict? What was the results?
well, I don't think they found it. They're asking
Oh,
if you can put in a link to
I will put a
the
link
addiction
onto.
test. And there's one for porn and there's one for general
Yeah,
sexual
I'm going to give you
behavior.
the.
My
I'm going to
dog
put it in the
wants me to play
chat.
with him.
So remember,
Um,
questions in the Q&A, and I'll put some things in the chat. This is that's the self-test for sex and porn addiction. So like, I want to clarify this is just a quick self-screen. This is, like keep track of the score, but, at the end of the day, like the assessments that we do with the clients coming into our program, completely different. Like, They take 4 to
400
5 hours.
questions.
Yeah, they're a lot, but we want to know. We want to understand the underlying issue. So yeah.
And by the way, people, and then I'll say this to Melissa because she put her name up. People lie. I know that, and they understate. And sometimes people who are in early recovery or just coming to the realization of their problem, they don't, they might not check off something as being as powerful or concerning as it is because it's just how they've lived. It's just how their life has been. I do, though, have to say there was something that struck me in the second part of your question, which was, I don't know why his heart hurts, but if he's actively acting out with sexual problems, not admitting to the entire thing, and you are in a meaningful relationship with this person, because you said spouse, my first thought would not be addressing his or her heart, his heart hurt. My focus would be on me. How do I feel and how this is affecting my marriage, my kid, my children? Do I'm angry that he's still doing this or doesn't really, that I have to like massage his ego in order to get him to take the test. I mean, my concern is more for you here, which is it sounds like you're lovingly supporting someone into understanding why they've cheated on you, and that just doesn't fit together. So anyway, Tammy, can you say a little bit more about why a spouse? Well, let me just say this. I think my behavior can influence others. The reality is the only way that I can influence others, or at least say where they are, is to focus on myself. Um, I cannot, and really, we can't control what other people do, and Lord knows I've tried. But Tammy, the question to me really is about loving someone and not wanting to really get angry at them and wanting to support them and but at the same time, like missing out on the whole part about yourself, or
Uh,
focusing on their healing and forgetting about me. Like, could you say a little bit about that?
Well, or focusing on their reaction. Like if I talk to him
Mm.
about this, and I'm using he and she, and
Yeah,
that's
yeah, to him.
just for discussion purposes. But I hear often from partners who are like, he'll get mad if I talk about that. So like they have to close down, walk on eggshells in order to, like they're afraid, like he's still acting out, or they're afraid he's going to act out because that would be the excuse
Right.
of if you made him mad, so now he's going to go, act out, and it's your fault. And it's not, and all of these wounds and childhood stuff, that's all. Yes, every single one of the clients who's
It's
come
all
to our
mushed
program
together.
has stuff, but until you stop the acting out, you can't address the underlying issues. So it's stop the problematic behavior and then get a plan for it. And some of this stuff is, I mean, it's not like they come to treatment and everything's wrapped up with a bow when they leave. They have a plan, but this takes time, and it's layers. And I really, in my own journey, have found that as I was able to take in the next layer, then the next layer became obvious that I needed to work on it. It wasn't like, I mean, I would have been overwhelmed and I would have never ever gotten into any kind of recovery if I had to dig down to the very worst stuff right off the bat. So
Yeah, as someone said something else. But let me just answer the bottom line. Is he an addict? I don't know whether he's an addict or not, but there is this sense I get from his behavior, which is he basically didn't give the whole story, and then he did give the whole story, and then he said, but it's not a big deal because I can go out with porn. I don't know. There's a whole lot of what I said earlier, like if I feel like things are good for me, I don't question them. There's a whole lot of questioning going on here, and a whole lot of secrecy and a whole lot of indirectness. So something feels uncomfortable. I don't know whether he's an addict or not, but certainly there's not open communication between you and him. And like Tammy said, there seems to be some kind of anxiety about how it's going to affect him, as opposed to you're taking care of yourself.
So questions in the Q&A. I will look at the chat later, but questions in the Q&A, please. That
Please.
helps. So yeah. So one more thing with this, it's like spouse talked with a marriage counselor, and what I picked up from that is the spouse talked to the marriage counselor. And again, if this is not somebody who's qualified to deal with these issues, I hear this all the time. Well, or he said that his therapist told him that he's not really an
Mm,
addict, like, first of all, he said, and second of all, was that person really qualified to, and how much assessment did they really do, with this person? And only only CSATs have, the battery of assessments that are, helpful in really figuring this out. So lots of questioning, but you're here. And so there's lots of resources for betrayed partners on sexandrelationshiphealing.com, including drop-in groups, lots more webinars and things. So keep coming back to these. The podcasts are all supportive, stuff too. So, okay. Next question. My wife still thinks I've not changed 2 years into recovery. She feels everything in our relationship is about me, like she is a planet orbiting me. I do forget things that are important to her. I don't consider her safety when I do things like go into work situations where I used to act out because I do that anymore. Is bookending everything the answer? How can I be more consistent and considerate of her needs? And he
Well, there's
doesn't
a
act out
lot
at
in
work
there.
anymore. Yeah. So.
Well, when you say you don't consider her safety, I assume you're talking about her emotions, and I have seen people who acted out in the workplace go back to that place of business, and every single time they go to work, it hurts their spouse. And, jobs actually these days are reasonably easy to find from what I hear. So, if it was hurting my partner and I was able to see that, especially 2 years into recovery, I might think about, is there someplace else I can work? Because, oh, no, 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 I have this job and I love that. I'm a partner, whatever it is. But look at your spouse, look at their face, ask them, what would make you the most comfortable? How can I, what is your goal here? What is your goal? I don't know if bookending is the right thing to do. Maybe you just shouldn't be there. I do recommend reading Out of the Doghouse if you haven't, because I think 2 years in, it is a really good guide toward helping understand what a cheated spouse feels like and how to address their fears and upset. It's a book I wrote, and there's also a course I think that we teach called Out of the Doghouse, a
Yes, and
relationship
I think
saving
it
guide for
starts,
men caught cheating.
I think the next one, don't hold me to this, but I think it starts on the 17th. So you have time to sign up for that. It's a 6-week, 90 minutes a week. And I think you'd find it very illuminating and helpful, on making some progress with this. But I was thinking the same thing as you, Dr. Rob, that there isn't safety with emotional safety. I'm also like, are you checking or doing the check-in every day? What conversations are you having about, like we talked a little while ago, like how do we put the relationship first? What are we doing that we're talking about
Mm.
our relationship? What we need, to move the relationship forward, not each of us, but to me, if she's feeling like she's orbiting you, there is a definite disconnect to how the two of you are working towards a mutual goal of the
Mhm.
relationship. So, um,
I want to add just one more thing, which is
mhm.
there's this sense I get about this couple, like I I'm in recovery and I'm working on myself, so everything's going to go back to normal, and
Ah,
everything's just going to go back to the way it was. And one of the things I think you have to realize is that there needs to be a whole different way that you live and how you focus on the most important people in your life than you had before. You can't just stop acting out and say, well, and work through some of the anger and the disappointment and say, okay, well, life will go back to the way it was. That the way it was left your spouse feeling like, how do I say this? You're not gaining a whole lot of emotional ground, leaves your spouse feeling like not a whole lot has changed. So, and we hear this a lot. And I understand that 6 months in recovery, you have not necessarily learned how to be a better person, but 2 years in. So, all I'm saying is that maybe you should stop forgetting things that are important to her. You say it like it's a fait accompli. Well, I do forget things. How about when you've betrayed someone and you're really trying to work on the long-term commitment in a relationship, you make sure you have reminders and it's on your calendar, and that you ask her, do you feel safe in my going this situation? Everything is not back to normal where it's okay to forget things and you can go back to work because you've been sober and working on this. I really think we have to, the question, how can I learn to be more consistent and considerate to her needs? Number one, ask her. And number two, I think, well, I don't know about you, but I certainly know when I've made a decision that is in my best interest and not necessarily in the best interest of us as a couple. I know. And the good thing is I know, so I can go back and clean it up. But I don't think that you need a whole lot of lessons other than what she has to tell you and how to be more consistent and considerate. In fact, I would bet she's already told you and you're not listening. When I think I've told you guys, we read impact letters in treatment and we ask all the spouses to send us a letter of what you've gone through. And when I read these things in group, so many of the guys say, oh, I've heard this a million times before, but I never was really listening. And now that we're sitting here in a group and my spouse isn't here and you're reading it like you read a book, oh my God, was that me? And so I think a more objective view than the way you've been looking at it would really be helpful, and not to learn how to be more consistent and considerate, but buy the book, take the course, and ask her, and then actually do it for the long term. Not, I've been 2 years in recovery, so now I can just be the way I was. Things will need to change for the long term. So anyway.
No, I love that. And if you're a successful person in business, you have all the tips and tricks that you need to be successful in business. So what do you need to do to be successful with this? And I use post-it notes and reminders on my phone and calendar alerts. And so if it's showing up and doing things, it's showing up and doing things. And if you have to have 12 reminders on your phone to remind you to do that one thing, okay, then remember.
Tammy, since you mentioned that, I am still learning that all I have to do is say, I don't want to bother him. Hey Siri, can you set up a reminder for tomorrow at 9 a.m. to drop off some flowers at my wife's office? Thank you. And guess what? You'll get a reminder first thing in the morning. My reminder is set for tomorrow. It's just that easy. Maybe you need to go out of your way.
Yeah. And I go back to what's going to be good for the relationship. And you
love that podcast, don't you? That particular one.
I do. I really, I have given that one. I mean, there's lots of them I give, but particularly, I think that is about healthy relationships, and it isn't just with your primary person. If I want to be in a relationship with somebody, we have to focus on what is helpful for both of us and how it's mutually beneficial, not just me. And it's actually been a very good gauge of people I want to be in a relationship with, because there are certain people that just can't show up, and no harm, no foul, but then I invest less of myself in that relationship. Exactly. So it's just helpful for me. I learn lots. But I want to continue to learn. So, okay. Here's a great question. Is it true that an essay can compartmentalize, or is it just denial?
Well, they kind of go together. I mean, denial is compartmentalizing. If I can say, oh, that's not really a big deal when it is, then I've put the fact that it is a big deal in a little box over here, and I don't want to see it. It's kind of like the guy who gets a DUI and he says, and on some level, the drinking got him in trouble, but he says, oh no, it was that police officer. Oh no, it was the red car, or, his denial, which is, I don't want to look at my drinking because then I might have to stop, but I can blame everybody around me. That is a form of compartmentalizing, because they're taking reality and they're putting it in a box and saying, oh, no, I'm not going to look at that reality. I'm going to put that one over there. Denial is, the simple way, didn't even know I was lying. And 9 times out of 10, it's to yourself. I didn't even know that I was lying to myself. And again, and that is a form of compartmentalization. So, yes, essays compartmentalize, and what that means is they can put. Let me say it differently. I've had partners say, "I don't understand how you could love me and do this," and I think that's a great example of compartmentalization. I really do love the person I'm with, and when I go out there and do this thing, I'm not thinking about them at all. They don't even cross my mind. I am so hyper focused on this. I think about them after. And how can I get away with it? But compartmentalization is not just about sex addiction. It's about all addiction. Alcoholics do the same thing. Eating disorder people do the same thing. They put the worst parts over here and they just say, I'm not going to look at that. It goes in a box. And by the way, that box doesn't affect anything else in my life because I put it over there, which is denial. They're sort of like a similar word. Tammy, what do you think?
100%. I was going, it isn't just SA. And the challenge is, if these things that are very compartmentalized and siloed, if those bump into each other, because we work really hard at keeping them very separate. And so then when there's discovery by a partner, then it's like, oh, I put this over on the shelf and no one was supposed to know about it but me. And now you just discovered it. And oops, really, really bad. And being confronted with the reality of our situation is problematic. And again, across any form of acting out, alcoholism or whatever the problematic behavior is. So we talk often that sex addiction isn't about sex. Alcoholism isn't because the alcohol tastes so good. It's about what it's doing for us. And that compartmentalization is taking us
Mhm.
away from reality because we don't have the coping skills to
Well,
manage things. Go ahead.
and if I had to look at reality, I'd have to stop. If I really, really saw that a DUI was because I'd been drinking while driving, I'd have to stop. And my priority is not aligning with the law. My priority is to keep drinking. So if I want to keep drinking, I have to put reality in a box somewhere else, not because I'm not interested in it. It's because it is in conflict with my addiction. And when you come to treatment, by the way, and everybody at Seek Integrity will tell you this, I will get very confrontive when I hear denial. And it's because if you don't work through that, then you can do what you did before and not even think about it. You go right back where you were. It's really helpful to understand the destruction, the harm, the pain, and the disappointments and losses that have absolutely come from the addiction. And you can't deny it when it's right in front of you. And it really does make it harder to go back to something knowing the harm that it's caused. And by the way, I will say this about treatment of all the addicts, whatever kind of treatment you do, my goal is to ruin it for you. You may go back to it, but you will never go back to it again without understanding what it's doing to yourself and others. And that is a powerful motivation to stay sober.
And I hope, but one of the things, it isn't just to haul all this junk up and make it unpleasant for you. It's because it's hurting the addict. Like we hurt everyone else too, but ultimately, I really believe that we hurt ourselves the most. And then there's everybody else, but we're disconnected from people who love us. We are lying. We are not living in integrity. We are not living our best lives if we're in active addiction. So we hurt ourselves and everyone else. And I know betrayed partners, you're going like, no, it hurts me worse. And part of it is because you found out. They've known all along in some compartmentalized way, and you found out. So it is different, and it's betrayal and it's painful. But they've missed out on all of this stuff that, was part of being in a relationship with you. They've been holding back and not letting themselves, really have the full magnitude of that. So it's hurtful across the board. We can learn to do things differently if we're willing to step into, if we're willing to take a few brave steps. There's support, there's ways to do things differently. We don't have to keep doing it. Okay, next question. Long-term SA partner in mid-40s acting out started with compulsive porn use in college and escalated during past years, all completely hidden from me until I found an ongoing Skype chat and eventually disclosure in November. I'm not sure I can ever trust that he will be fully satisfied with a monogamous sex life, although he claims he will be. While he's worked hard in recovery, emotional and physical intimacy are still a struggle for him and frustrating and lovely for me.
Lonely.
Lonely. Thank you.
Yeah.
I was trying to
It's
align those
okay.
two. Thank you. We have not been able to reconnect sexually, and he is displaying anorexia. I'm concerned whether after so many years of extensive porn use and stimulation, whether he will ever be completely satisfied with just me. You are not alone. This is a recurring theme. So,
Well, there's so much to say here. I guess one of the first things I want to say, and it's useful for the addicts, is when I am acting out sexually in an addictive way, what I'm seeking is intensity. What I'm seeking is breathtaking, heart pounding. Oh my God, this is amazing intensity. Oops, someone's calling me. And let me say not right now. And then when people stop acting out, they expect that their sexual life with their partner will be the same. When I'm walking down the street as a sex addict, I'm looking at body parts. I'm thinking how I get that going. I can't wait to get home to the porn. I'm not thinking about people. I'm more thinking about my own excitement. But sorry, my dog is doing something down there. However, when you are connecting with a meaningful partner, sex doesn't come from a place of horniness, of, oh my God, that's so exciting, I want to do that. It comes from a place of willingness, especially for us. We are trauma survivors, for sure. I was writing someone a note about some of the things I went through growing up with my mom, and they said, it's amazing, you can walk and chew gum at the same time, um, which is something else I want to talk about here. But um, maybe he doesn't know how to go to reconnect with you. And so he's withdrawing. And plus, by the way, and don't tell my husband, he knows this, I would rather, um, I'd rather read the New York Times from cover to cover when we're lying in bed together than have sex. I'd rather take a math test, because when I'm presented with sex with my partner, what comes up for me is fear. I was so enveloped and used and had my own different forms of incest that someone I love coming toward me for sex is terrifying. I want to go to the next room. I mean, I know this now. It used to just be, I don't feel like it. Now I understand there's much deeper feelings there. And so, what I had to learn was, is there a different way to approach sexuality other than, okay, we're going to go do it, or that intensity that I looked for when I was acting out sexually? And I think a good way to look at it is, can we, rather than he's been sexually anorexic and blah, 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 could you hold hands? Could he lie with his head in your lap while you stroke his head and massage his shoulders? Can he, uh, what I'm talking about? I'm talking about building connection rather than worrying about getting to arousal and penetrative sex. And what he might learn, well, let me put it this way. I can be lying next to my partner saying, the last thing I want to do is have sex with you. But what I can do is try massage. What I'm willing to do is, put your head in my lap and we'll talk sweet things, whatever it is. And, it's interesting for sex addicts, because we do this physical closeness with you and then, oh my God, I'm aroused. It's shocking to us because it didn't come from this heart pounding excitement. And then we are sexual, which is often profoundly better, I think, physically and emotionally than it is with a stranger. I don't know why. It's a brain thing. But if you the best way I could say this is, and this doesn't come from me, I have to admit this, but I love this phrase, that sex for recovering addicts has to come from a place of willingness and not a place of horniness. I'm not going to say, and plus there's one more thing. If we've been together for a while, no offense, but I've seen that butt before. And so if I'm looking for intensity, that old butt, love you dearly, but I saw that about 20 years ago when it was more perky. And I'm being silly, but the
I
point is that
understand.
men seek stimulation and we seek new stimulation. That's sort of how we're built. And so, this is why we say, do it in a different place, go on vacation, try something sexy on, not, because it revitalizes us. So, I really do think that if you could start out on a journey of his being willing to try some things, it's amazing that we just find ourselves getting aroused and being sexual when we never expected we would, because what we want is to look at our partner and say, oh my God, I can't wait to do that. And let's get to it, because that's what we do when we're acting out. But it's a whole different thing when you're with somebody. And honestly, like I said, he just may not know how to get from where he is to where you want to be together. So some thoughts for you.
Well, and we've talked before about sensate focused, where it is the touching with no plan for there being penetration. It's we're just going to touch and snuggle and cuddle and and connect. That's what real intimacy is being vulnerable. That's I hear often people saying, we're not intimate, and I know that they're talking about sex, and I was like, there's a whole lot of intimacy before sex, and sex addicts often prove that you don't have to be intimate to have sex. So the sexual anorexia, I hear often too from addicts that are like, they're just afraid, and embarrassed and everything else, and it's so awkward. It's like, backing up the clock to when you're a teenager and going, I have to start all over again, but this is with a person and I should know all this. And so being willing to be vulnerable and laugh about, like, we're just going to be awkward and it's going to be okay as long as we're together in this. I think that that's a different place to start. But I hear you saying I'm lonely. I hear, the disconnect being problematic. I also hear like it says this was just in eventually disclosure in November. So you're into
Right.
this, but it's still early. And so I think giving both of you some grace and space to
Everything.
go, we're going to,
That's only
yeah,
6 months.
I know. And so that's
Yeah.
part of what I'm going is like, it's okay. And just owning that it's okay. And, but having the conversation of what is it we're looking for and what can we work towards and what baby steps can we take to get there? It doesn't have to go from 0 to 100. It's like, we're going to go from 0 to 5 miles an hour, and that will be okay. And you start connecting those emotional touch points, because in my loneliness I would be withdrawing and he's withdrawing, and so then you've got two people who are
Right.
that are
Stuck.
withdrawing and disconnected. Yeah. So you were talking
I,
about
I, I
walking and chewing gum. So
I did put a link to Sensate Focus up there if
oh,
anybody is
good, thanks.
interested. I try to cover you, Tammy, on the backside here. Um, yeah, I do believe that he wants to connect with you, and I do believe that monogamy one day at a time is certainly, it's sort of like a whole different, again, this is a whole different thing. Building an intimate and loving relationship with someone, it doesn't sound like he's really done a lot of that. So what is monogamy if you haven't really built that in the first place? So yeah, this is a really good question.
Yeah, but don't give up hope. I mean,
Oh,
like,
I
yeah,
have,
go ahead.
sorry. No, I'm so sorry. I wanted to add to that. I haven't been doing enough spooning lately. And I realize that as I get older, it's so easy for me to pick up my device and start reading. And my spouse is, doing something on the other side of the bed, and we never actually physically touch. He falls asleep, I fall asleep. Here we are in a 21-year marriage, and it's easy to forget. Um, Tammy, we've been struggling a little bit as a couple, and one of the reasons we absolutely realized is it's screen time. The TV's on all the time, or get in bed and pick up the device. And I don't mean, I love technology. I used to teach a course on tech for the CSATs, but I do think I had to be much more conscious about things that just had become a norm over time that were keeping me from being intimate. I don't have to have sex, but I'd like it, but I would love to spoon. I would love to be held. I would love to connect in those ways. It's so meaningful to me. And for some reason, it can slip away. And I think the distractions, TV, let me tell you, a TV in a bedroom, deadly. TV in a bedroom, deadly. TV on when you're having meals or have that opportunity at the end of the day to check in, deadly. And what I found was we're not talking to each other, we're not connecting. And it wasn't that we didn't want to, it's just that I had one eye on that and one eye on that, and I wasn't really hearing anything. So anyway, you can also make it easier to connect by reducing the distractions. I guess is what I want to say. And I had forgotten how simple that is. You just put it down.
Because it's so insidious. It's like it just happens, and then all of a sudden there's I realized the other day that I am petting the dog way more than I'm touching my husband, and I was like, I mean, I have to shift that isn't,
Right.
that's not what I want, for a relationship. But I'm like, I'll pet the
It's
dog
so
like nonstop. So yeah.
I am
So
so glad you said that,
yeah.
because sometimes I'm going coochie coochie with the dog and petting, and then I think I'm not doing this for him, and that's not. And I feel like I've been caught, like giving too much love. So what I love about all of this is being conscious that we
Hmm.
are talking about this, and that's what I'm asking you to do: is be more conscious about your connection rather than worrying, can I be monogamous? Can we have a sex life? Try to focus on the moments that you're going to create, and
Hmm.
maybe they won't be all the way to 100, but they might be 30, and next time they'll be 35. And it's a process of reconnecting with yourself and someone else. And I really, sobriety is a done or not done deal, but what we're talking about here takes a long time, in
Yeah.
personally and as a couple. So I agree with Tammy, be more gentle with each other, but do head in the right direction, like
Hmm.
holding and doing fun things together, and all of that.
Okay.
Okay,
Next question. What is the
next
difference
question.
between a chronic cheater and a sex addict?
Well, I can't say mean word. I can't say those four-letter words here, so I prefer not to, but I can think of some differences. So I don't know what chronic means. Does chronic mean like every couple of years, or there've been one or two affairs, or does it mean there's always an affair going on, and for 25 years there's always been someone else or a number of someone else's? Because that's sex addiction, you know. So the word chronic, I don't, so I don't know you or the situation well enough to say what that means. So I can't really answer your question. But if I take the word chronic out, I can say the difference between someone who cheats and a sex addict. Someone who cheats, in my mind, and really isn't addicted, and doesn't have all that trauma and all that BS, especially someone newly in a relationship, I think that they're immature. It's back to that Stan Tatkin podcast. Oh, and by the way, do throw that podcast in the chat if you, because we keep
I
talking about
will.
it. Um, um, I think that people who cheat are not able to keep their partner in mind. And what I mean by that is, when I go, this is absolutely true. When I go to when I go shopping, now it's on Amazon, and I'm looking at shirts, I think about my spouse. I mean, I can't help it. It's like, oh, I think that would be a great color that he would like, not just me. In other words, my spouse is in mind. I'm not just going out and saying, what can I get for me? And that was fun. I can't even help it. It's like, oh, they might like that. And I think the immaturity of cheating is not having your partner in mind at all. How would that make them feel if I do this? I've already made up my mind, as what they don't know would hurt them. And so, but I also think someone who cheats when they get in trouble or when they get found out, um, they can stop. They can say, wow, I see all the mess that this caused, and what was I thinking? And I went to that bachelor party and this happened. And so if I take the word chronic out, I can say that someone is not able to keep their relationship and their partner in mind when they're out in the world is immature or has some work to do. Sex addiction is different. It's not a matter of maturity. It's a matter of being psychologically broken. Sex addiction is about deep scars to our sense of self that leave us compartmentalizing and splitting love and intimacy from sex. And we will always be stuck with that split. I think someone as a cheater can learn to respect, learn to grow, learn to change, learn, become a parent, and then they want to live all kinds of, but we don't have a choice without help. I cannot stop, nor do I know how to stop what I'm doing unless I really have support and direction in changing. And whether that's therapy or 12-step programs or some of the, by the way, we have a fantastic training series. I'm going to push that. What a lot of people, I'm going to jump topics now. A lot of people don't get the educational piece in therapy. When I go in for an hour a week or 2 hours a week, I work on my stuff, but I don't learn about the cycle addiction. I don't learn about trauma and how that affects addiction. And those are topics I need to learn. And so we are teaching these courses about how do you betrayed partners. You may go to a therapy session or a therapy group, but are you learning about what does it mean to forgive or not forgive? What is the betrayal of trauma? What should I expect from someone? A lot of the questions you ask spouses are going on in the betrayed partners group, which is what can I expect at 6 months and all that kind of stuff. So I just want you guys to know, we don't make a ton of money from it, but the opportunity to get the education that you don't get in therapy, and maybe you didn't read the whole book or get to know exactly the most important part of the book. We're sitting there explaining, and well, I would think we're a master class. We have master classes in sex addiction. And go ahead, Tammy.
Sex addiction, porn addiction 101. The trade partner group starts June 8th. Eddie Caparucci's Going Deeper. The inner child work starts tomorrow night. Out of the
Tomorrow.
Doghouse. You talked about all of those. Those are 6-week courses, and most of them are 90 minutes. The betrayed or the healing from betrayal couples started last week, and that's 2 hours. But otherwise, they're 90 minutes once a week, and those are really good, solid psychoeducation, and all done via Zoom. People from all over the world are joining those. So,
You know what, Tammy? Something that we might want to mention, just as a part of that, while we're doing a little self promotion, is that we have a space, I think, on Amazon where all of the books that go with
mhm,
those courses exist. So there is
mhm.
a Sex Addiction 101 workbook. There's a Porn Addiction 101 workbook. Don't think the Betrayed Partners is ready, but I know Out of the Doghouse is up.
It's in
And
process,
what that
right?
means is that when you take a course, you have a workbook and you have homework, and we expect you to do it. And so there's a lot of discussion around not only what happens in the educational process, but what I learned when I was doing this last week. Um,
Well, and to that point, it's like if I read a book, I read it with my lens. And as an addict, I'm really going to be kind to myself and not see things and not think that's a
no.
problem. So having the discussion, all of these are live facilitated. And so having the discussion, there's a lot of aha moments where like, oh, I hadn't thought of it that way. Oh, that's also part of, but it's just, most of them are, they're under $400 for a 6-week course. So please check those out. We run Sex Addiction 101 every month, Porn Addiction 101 every month, the Doghouse too. So, but we've added more and we've got more coming too. So,
And I want to put in a small caveat for your addicts. There's a great sales plug for our courses. Your spouse will feel better watching you go to that course every week and having the workbook and doing the work. They will feel like, oh, look at him or her. Well, it's only men in that program, right? Look at my guy diving into the work and doing the homework at the kitchen table on his own. And it will make your spouse happy. How's that for a
no,
sales pitch?
no, it does help, but the insights that people. I've had therapists that have talked about. I love having my clients go to those work groups because they get the psychoeducation, and then they have more information that they're bringing back to the therapist, so they get to go.
And the
It's
spouse.
yeah, but if they're digging into stuff, they have more to take to their therapist to work with, to help get in a different place quicker. So we've got two ones in the chat. I'm going to try to get to this one too. So, but the next question is, can a person develop a sex addiction later in life due to the explosion of the internet, or is there always trauma?
Well, the question to me would be about porn, because I absolutely have seen people, let's say a guy retires or a woman retires, and all of a sudden they don't have the structure and the support, and maybe their other partner is out working or they're alone. They can get really involved with porn and later life become very addicted, if you will, to that being their place to go because they're lonely or they had a life change and they didn't adapt to that life change, or someone died and they got involved with the porn while they were grieving. All of a sudden they realized. So for some people, um, it becomes a later life thing because um, often something's going on and they find themselves doing that more and more often. I think there are late life alcoholics, there are late life gambling addicts. There are people who have the potential, but the stress wasn't right or the distraction wasn't right. And all of a sudden they fell into it and there they were. Um, but so if it's porn, I think absolutely. If it's general sex addiction, no. I think that almost all of us have early life experiences of acting out. I don't think there's anybody in treatment, Tammy, that I can think of who couldn't recall that they started acting out in their 20s. I was 14, but some at least started in their 20s. And so someone later in life, I don't think so. If they're a sex addict, then they just took advantage of the explosion of the internet, if you will. It's much easier to act out now. It's much more anonymous to act out more. It's much cheaper, and I don't have to go to some bar and put on some bad cologne and risk that someone's not going to want to be with me. These days I can just put a few lines in an app and there's 30 people and they're all within 5 blocks. I mean, it's a whole different experience. So yes, access has changed tremendously to sexual content. But, you know, marijuana has become legal in California. That doesn't mean everyone who smokes marijuana has become an addict. So access is not the only issue. You have to have a predisposition or a stressor going on. And addicts tend to have a predisposition and start early in life. And by the
Well,
way, there are other people who say, oh, it didn't happen until I was 60. And it's not unusual. They might be lying to you.
lying, or they were working 80 hours a week, or they were
Right.
drinking heavily, and especially binge drinking on the weekends when they weren't working, or there was something else going on. So and as far as it's, is there always trauma? I talk about trauma, neglect, abandonment, grief, loss. There's something that can be at the core of it. Is it always identified as trauma? I mean, I think abandonment can be a form of trauma, but so so I agree with Dr. Rob that highly unlikely that it was completely isolated, you know, unless there's like I've heard of some people that are on like a Parkinson's medication could be, I mean, there could be something if there was a medical condition that, you know, to be to look at. We have one more in the chat, so I'm going to read
Well,
this
wait,
to you.
before you
Go
do
ahead.
that, there's a
Okay.
question that got skipped over that was in the Q&A. So I want to read it.
Oh,
Hello, I'm 28 years young, a gay male. I'm a
I
porn
did
addict
not see
willing to
this.
get the benefits of
Oh,
recovery. How does one go about the process of finding a sponsor? Keep these ones in mind as we go through, Tammy. I'm recently sober and new to the 12-step process and wanting to work the steps. I regularly attend a process addiction therapy for my porn addiction, and I watch, you don't watch my podcast, but you probably listen to them regularly. Thank you for your time, as always, much love. So I had written this person back saying, you know, I do think you should read Cruise Control because it's the only book I know written for gay men who are sex addicts. And I think it really will help differentiate and help explain the trauma piece, the 12-step piece, even the sponsor piece. But Tammy, these questions are universal. How do I find a sponsor? You know, how do I work this step? I think that you would be a great person to maybe, you know, give some feedback.
we have bunches of resources. Yeah, and you typed the answer. That's why I didn't see it in the live
Well,
one. So
just about
that's
the
why.
book, not the
No, I know,
general
but that's why
answers.
I missed it. So I'm going to put there's a whole section of and I'm putting this in the chat under the resource tab on sexandrelationshiphealing.com. There's a whole a video series that went through working the steps. So that's one thing.
Oh, it's so
The
wonderful.
biggest thing is like you raise your hand and say, I need a sponsor, you know, and it's not a lifelong commitment, you know, unlike, you know, a long-term relationship. This is like, you need somebody who has something you want. You need somebody who's done the steps, you know, like I hear this all the time, that, well, my sponsor hasn't even done their 4 steps. Wrong sponsor, you know, like find somebody who's actually doing the steps and following through. You know, there's in the groups that we have on sexandrelationshiphealing.com,
They
there's
are
a
no
lot of
cost.
people.
Like, they're
They're no
free.
cost. They're live moderated, so they're safe spaces. And there's lots of guys that do peer connection. So that's somebody to find somebody to peer connect with. But really, I said this in a meeting the other day again. The elevator to recovery is broken. Please use the steps. Working the steps is proven as a method of, you know, making progress. I strongly believe in that. Now, was that going to be enough for me? Heck no. So I needed a therapist, a group therapist, treatment. I needed a lot of help, but I got it, and I continue to, you know, work the steps on a daily basis, you know, which is helpful. But you need a sponsor that's for this phase of your program. You may go, okay, now that I've outgrown this sponsor or this, I need somebody different. It's all good. So, but the biggest thing is raise your hand and say, I need a sponsor, you know, and somebody better step up. So,
Yeah, I just want to add 2 little things. One is a sponsor is a role model. And in order to have a role model, they have to be where you would like to be so that you can learn from them. So, you know, if you're in a relationship and you just had kids and, you know, you betrayed your spouse and you're looking at someone who's a year down the road and they've worked it out with their spouse and they're being a better parent and they're feeling that might be the person, you know, choose someone who's a few steps down the road from you, but you share enough so that you can kind of aspire to what they have. Because I find that really, you know, someone I admire, I want to have more of what they have and I want to learn from them. And that's kind of what you want. But I agree with Tammy, it doesn't have to be a lifelong commitment. And you can even have something called a temporary sponsor, which is, we were talking about these people to people connections, someone I can call, someone I can connect with, someone I can learn from. And they may not be the long-term commitment I'm looking for to work with a sponsor, but it sure is important to build social relationships. Do we have a group for gay men on SRH, or is it just the
we
drug
do.
and
We have a
sex?
cruise control group on Thursday nights. It's specifically for so
Gay
on
sex? Right.
sexandrelationshiphealing.com, that group. But you know what? There's gay, straight. It doesn't.
Right.
They're in every one of the. Don't just go to that one. Going
Right.
to just one meeting is not enough. So you can't do too much, you know, early in the process, and you know, make friends. good. So,
And what you have in common with the people in that room is you have a porn problem.
mhm,
It doesn't really matter if you're gay or straight or this, that's what you all have,
mhm,
or work for a lot of money or sweep streets. What you have in common is the porn problem. And, when we do treatment seeking integrity, people have said, oh, you just see gay men or you just see straight men. No, I see men. I see troubled men who have intimacy disorders. And by the way, one more thing, Tammy, that person long, long ago who was talking about how disconnected they felt from their spouse and they weren't being sexual. And
mhm.
I just want to say, like, this is an intimacy disorder. Sex is the presenting problem, but the real issue is getting close to people and feeling safe and building connections. And I don't mean intimacy in terms of sex. I mean intimacy in terms of emotional connection, being known, and vulnerability, and all that good stuff. So if we knew how to do that stuff, we probably wouldn't act out sexually. Once we stop acting out sexually, we still don't know how to do all that stuff. Um, but it is a problem of intimacy, and sex is just, for many of us, just the biggest presenting symptom. That's what I want to say. Hey, dinner time, dinner time,
Well,
feed the
there's one
dog.
question, and it kind of feeds. So hang with me for just another minute. So, what are your thoughts on the validity of Celebrate Recovery? It's in chat. It takes 2+ hours. It's where my SA husband is right now. Instead of joining this live chat, my husband already travels a lot for work, and I feel like I'm raising our baby alone. He goes to SA meetings too, but the balance of his recovery work doesn't seem right. Many of his daily recovery tasks are just reading. So just what you were saying, Dr. Rob, is it's about creating a connection. As far as Celebrate Recovery, it's another form of 12-step if it's a fit. My
It's
one
not
big
really
well, I know my one
12
big
step.
problem with it is that it's typically once a week, and that isn't enough. So I hear you feeling alone and lonely. I don't know what you're talking about with to him about like, this is what I'm looking for for you, how you can show up for the relationship. He travels a lot for work, reading and doing 12-step groups while he's traveling. Maybe a smart thing if he's working there. I used to go to, and I still do actually, go to 12-step during my lunchtime.
Oh,
That was a good thing for me. It broke up my day, but it was also like I didn't take away from other family time. So there's lots of ways to do things differently. My big suggestion to you is, what are you looking for? You need him to get recovery. You really, really do. And while it feels like he's just shifted everything, it goes to what Dr. Rob said about it being an intimacy disorder. What are you guys having the conversation about? What are we doing for our relationship? And how is he showing up for the family? How is he showing up for the child? How is he taking care of the child that is his, so that you get some alone time and you get some opportunity to refresh? So, like, to me, it's a lot of the conversation of how do you lay out the schedule so that there's accountability for his recovery and he's able to do that work, but there's also you time, family time too. So, thoughts, Dr. Rob?
I was looking at the Celebrate Recovery website while we were talking, and I think it is a series of groups around the country that meet. I don't think it's not 12 step, but it is people who meet. But what I saw was there's no specificity. It's just about recovering addicts. I didn't see that there were groups for different
Oh,
kinds.
I thought
So
there was
Celebrate
separate.
Recovery is about
So,
recovering from addiction. But let me tell you, if you're a sex addict, you need to be with people who have sex problems. I mean, who's going to raise their hand and a bunch of people who are alcoholics and say, I have a masturbation problem? I mean, that just ain't going to happen, because you're the pervert, you're the sleaze, you're the one nobody wants to talk to. So I don't, whatever group you go to, it's essential that you were with your peers. Who is going to talk about sex with a bunch of people with other issues? And this is one of the challenges I have with treatment programs is, someone like, oh yeah, we treat addicts, all addicts, we treat drug addicts, sex addicts, gambling. No, unless you have separate groups and separate therapists for each one of those populations, especially the sexual. Put your drug and alcohol people together. No offense, Tammy, but I can
no,
see
I
that
agree. Yeah.
substances are what they
Yeah.
are, but sex is not something you want to talk about anywhere. And I will say that, having been in lots of different meetings, and no offense to other programs, but there's something so personal, so vulnerable about talking about such an intimate part of yourself in a room full of people. And that just doesn't happen everywhere. So you want to fit in one of those meetings into what you're doing during the week, I would say great. It's one of 6 things. You get one day for that. But what are you doing the other 6 days that are directly related to sexual recovery or porn recovery? Because if it's not specific, you're not going to do as well, whether it's a treatment program or a therapist or meetings.
Yeah.
Okay, my dog is
All right.
nipping at
No,
my feet.
and I'm going to
I
the
am
gym, so I'll see you guys later. So
nice
bye,
to see you,
everybody.
Tammy. You have a good
Thanks,
week.
everybody.